Hi, I'm Dr. Peter Coleman, a retired physician and addiction medicine specialist with over 40 years experience treating patients with addiction. And today we're going to be talking about the fact that genes predispose people to the disease of addiction. One of my first patients when I first started practice was a patient who needed to be detoxed at a hospital, and she was about 25. And she was drinking so much she needed detox even at age 25, which was stunning by itself. But what was most interesting is she had grown up with an alcoholic father, and she had swore to herself she was never going to drink because she didn't want to turn out like him. And she didn't until her wedding day. And on her wedding day, her husband said, "Let's have a glass of champagne." And she thought, well, why not? Within 6 months, she was drinking a fifth of liquor a day. It was unbelievable. She was like an accident waiting to happen. And it just made me realize how strong genetics are in this disease. People have been knowing that addiction runs in families for a long, long time. And when things runs in families, it's either the environment that causes it or it's the genetics. And of course, it looks like it would be the environment. People who grow up with an alcoholic parent would be more likely to drink because that was the normal thing, and all the stress of growing up in an alcoholic home. But it turns out the studies show that genes are more important than environment. What are the studies? Well, first, there are twin studies. So if they're identical twins who have exactly the same genes, they have a very, very high 70 to 80% rate of concordance, where if one of them has an alcohol or drug problem, the other one does as well. Fraternal twins, brothers and sisters or two brothers, they share the same genes as regular brothers and sisters, and they have a 4 times higher rate of alcoholism than people in the general population. So again, genes seem to be very, very powerful. The other studies are adoption studies where a child gets taken from one home into another. And so with birth records, you can know whether the parent, the genetics, were alcoholic and whether the environment that they were adopted into was alcoholic. And the way the studies go is that when a kid who comes from an alcohol-dependent family, but they're raised in a normal home with no heavy drinking, they still have a much higher rate, around about 40% chance of developing alcoholism themselves. So the genes seem to be the important thing. When they look at the opposite, so there are kids who come from a home that there was no heavy drinking and they're adopted into a home with heavy alcohol drinking, you would think, boy, they would really be likely to become alcoholic, but they don't. They don't have an alcohol problem any more than people who in the general population. So the negative, painful environment didn't cause those people to develop an alcohol problem. So genes just look like they are incredibly powerful. And when smart researchers look at this, they estimate that genes contribute at least 50% of what is likely of whether somebody's going to develop an alcohol or a drug problem. So that's very, very powerful. We'll talk about childhood trauma and other things that affect that in later videos. I had a patient, Maya, who came in with her parents, and she had a severe problem with opioids. I think she was using oxycodone at the time. And she was kind of confused because mom and dad didn't drink at all. There was no drug use in the family when we took their family history. But when I looked into it deeper, both of her grandfathers were alcoholics. And so both her grandfathers had drank so much, and her parents had both decided they were never going to drink, a little bit like my first patient. And so they didn't drink at all. And so they raised this child with no heavy drinking, no drug use in the family, but Maya still became dependent on opioids and had a serious problem. So what had happened was her parents had still inherited the genes, but they hadn't expressed it because they didn't drink or use drugs, but they'd still passed those genes on to Maya. And so she still developed the disease. We also saw a similar situation with adoption. So I had a patient, Trevor, who came in from West Virginia, and he was shooting heroin and just in terrible trouble. When I took his family history, his parents were like, well, we don't do alcohol or drugs? We've raised him incredibly wrong. Where did we go wrong? Well, they weren't really sure. It turns out he was adopted. And when I asked more about that, they said, oh, yes, he was adopted because his mother had a heroin problem and he was taken away by Child Protective Services. So again, poor Trevor, he inherited the genes from his mother. He was raised in a nice environment, but it didn't really protect him from developing the disease himself. What are the genes that are involved? Well, researchers have found at least 100 genes that are associated with people who develop an alcohol or a drug problem. None of them are particularly powerful. They all have some effect, but none of them are like, oh, if you have this disease, this gene, you're definitely going to get it. If you don't have this gene, you're definitely not going to get it. So it's a little bit like height. There are hundreds and hundreds of genes, or lots of genes for height. So if there was just one gene for height, people would either be really tall or really short, but everybody's somewhere in the middle. So if you inherit a lot of genes for height, you're very tall, and if you don't inherit many, you're quite short, and most people are somewhere in the mean, so in the middle. So the disease of addiction is very similar to that. Most people think that at least some of the genes, the powerful ones, are to do with dopamine, which we've talked about in other videos in the pleasure center, and it's at the heart of what addiction is that people get addicted to the dopamine spike that they get from drugs that give them this very high dopamine spike. So it makes sense that dopamine genes would be really powerful. And one of the best models that I like and I use with my patients all the time was what's called the low dopamine tone model. And I tell people the best way to think about what's happened is you were born with a brain that's a little bit low in dopamine. It's not a big drop, maybe it's 95%, something like that. So it doesn't mean you didn't have any pleasure growing up or playing games when you were a kid. But it's a little low, and when you took a drug that gave you a super high dopamine spike, whether it's alcohol or cocaine or any drug, it gave you a stronger effect than normal people would have gotten. And so your prefrontal cortex loved it, and you started deciding, I'm going to keep doing that. And so you kept doing it, and then other changes started happening in the brain, and the disease of addiction developed. So the best way to think of it is it's not your fault that you were born with those kind of genes, but it is your responsibility, once you know it, to then take care of your disease and stay in recovery.